Welcome to the Floyd Memorial Library podcast, a window into the soul of the North Fork of Long Island. We'll delve into the pulse of our community, its pressing issues, promising opportunities, and the rich stories that weave our shared history. I'm your host, Christopher Bianchi, and for episode 99, we sit down with Paul Connor, Chief Administrative Officer at Stony Brook Eastern Long Island Hospital. Paul shares the story of his upbringing, his educational journey, and what brought him to the east end of Long Island. We explore his path to the North Fork, where he became CEO of Eastern Long Island Hospital in 1999. Paul delves into the history of the hospital, the transformative changes he's overseen, and the landmark merger with Stony Brook Medicine. He reflects on the vital role of nursing, the challenges of navigating events like Hurricane Sandy and the COVID-19 pandemic, and the importance of planning for future emergencies. We also discuss the hospital's innovative programs, the development of new centers, and Paul's vision for the future of healthcare on the North Fork. So I hope you enjoy episode 99 with Paul Connor. This episode was recorded October 11th, 2024. Thank you so much for coming on to the Floyd Memorial Library podcast today. It's really a pleasure to have you on today.
Well, thank you. I look forward to it.
Thank you. So I'd like to start off in the beginning, if you can give us a little introduction about yourself, where you were born and raised.
So while I was born in New Brunswick, New Jersey, I was really raised on Long Island in Garden City, where I went to high school.
Mm-hmm. And in terms of moving forward through school and coming out of high school, did you know what you wanted to do as a career?
No, I was a typical 18-year-old, although, you had the Vietnam War happening when I graduated in 1970. I liked the sciences, and ultimately I went to Long Island University in Southampton, where I got a degree in marine science and environmental studies.
And then we're probably jumping a bit from there, but how did you come to the North Fork and eventually what drew you into the healthcare administration?
So it was sort of a default process that I would have had to gone on and gotten my master's and ultimately PhD if I wanted to really work in marine science, marine biology. And so I wasn't sure I wanted to pursue that at that point. My father, who was a hospital administrator, kind of gave me a break and said, look, if you're interested, I'll pay for some of your graduate school. So that sounded pretty good to me. In fact, that's how I got started, where I went to CW Post to get my master's degree and really started in healthcare in 1975.
And when was the first time you came to the North Fork?
So we would vacation on the North Fork, and I was familiar because I went to Southampton College. So I was familiar with the North Fork and Shelter Island. And of course, it's such a beautiful area, and everybody wants to be out here all the time. So we have the same feeling, and we would vacation out here for 2 weeks in East Marion, my whole family. And we always kind of wonder, how can we live out here full time? I always said, maybe I could run that little hospital, and be careful what you wish for, because it so happened that a friend of mine was retained by the board at Eastern Long Island Hospital to conduct a search for a CEO. And this is back in 1999. And he encouraged me to apply. I did. And, 25 years later, I'm telling you this on a podcast.
And I just had a question before we move into starting your career there. I don't know if you could give us a little history of the hospital and when it started and before you got out there.
Well, the interesting thing about Eastern Long Island Hospital is this small hospital out in Greenport, and how did it ever come to be so far out on the Long Island? In fact, the hospital was basically developed in 1905. That's when the board came together and decided they wanted a hospital. It is the first hospital in Suffolk County, and I believe the second on Long Island. Mm. They were fortunate to have a community that really wanted to get a hospital. You can imagine if anyone really required serious hospitalization, they'd have to go from Greenport to Mineola for hospitalization. And I'm sure that was a long trip and a difficult one for someone who had been sick. So the community came together. They applied for and received approval to develop this hospital. Two sisters, the Wood sisters, donated a home that they had recently acquired in Sterling Harbor, where is the present location of the hospital. And that home served till 1930 as the main hospital. They put an elevator in it, and so the hospital then built a building in 1930, and then 5 buildings later, the last building we built was 2008, which was the ambulatory surgery facility. So we have 6 buildings ranging back from 1930. Of course, the mansion no longer exists, but we have the Red House on the property that had been there since 1905.
And now you said you started in around 1999. So when you initially got there, what were you working on at that time? What was the community looking for?
So it was an interesting time, because when I was interviewed by the board, they said, well, we have ongoing discussions with what is now Northwell, it's North Shore. We were part of a 3-hospital system called the Peconic Health Corporation with Southampton, the Central Suffolk, now Peconic Bay Medical Center. So we made up a little health system. So we could have been acquired by North Shore at that point. There was a movement on the board to be able to try to become part of a larger system to ensure the mission would continue and that financial viability would be achieved, because that was elusive for that hospital. And for most little smaller hospitals, financial stability is a big challenge. So none of that happened. We retained our independence until 2015. When the board decided that we would merge with Stony Brook. And then now we're 5 years into it. And it has been a important and really beneficial journey for our hospital.
Mm-hmm. And then so in terms of over that time between 1999 and now as CEO, in terms of the healthcare technology and practices that have advanced significantly, how did you navigate the adoption of new technologies at that time while still maintaining the hospital's core values?
So the technology, in order to be a contemporary hospital, you have to be in a position to adapt to new technology. This included an electronic health record, the first electronic health record we've ever had in 2003. That was a big challenge, not only to basically implement it, but to pay for it. Mm-hmm. But we did, and we continue to have the same electronic health record now as it continued to be improved and modified over the years. We will go to one platform with Stony Brook, probably in 2 years. So all 3 of the hospitals will be on the same platform. Right now they're installing it in Southampton. So that was really an important change for us in the practice of how we cared for patients and how that care was recorded. New technology in imaging and life support, we certainly acquired and adopted. And the key to maintaining the culture and the mission really is a challenge for most organizations. But we seem to fall into this community culture that reflected the community that we served, which is basically the 10 zip codes from Laurel to Orient, including the 2 in Shelter Island. And that's where we recruited most of our employees. So this culture of caring, this high-touch culture, something that was already there when I came, and it was very important for us to maintain that culture. And even with the challenge of recruiting now beyond our 10 zip codes, because the community has changed, it's aged. A lot of the families that represented the North Fork have moved away, and we have a new population here. We have a retirement destination. We have the oldest population per capita in the state of New York, where 32 or 33% of the population is over 65, compared with Suffolk County, which is about 17 or 18%. So maintaining that culture for us was everything, and continues to be, especially now where we are part of Stony Brook. We still want to retain our identity and our culture. And I think we've done a pretty good job of doing that, despite the challenges and the changes in our employee population, because no longer can we recruit. Maybe when I came in 1999, we recruited maybe 75% of our employees in our 10 zip codes, or at least on the North Fork and Shelter Island. Now it's less than half. And then maybe, another 20% when you go to Riverhead. And then all the other individuals come from, beyond that area. So it's important for us to engage our employees, to be able to recognize our employees, to understand what the culture means to our patients. And we have ways of measuring that now in healthcare. We have HCAHPS, which is kind of a tortured acronym. I won't go into it, but it's the way Medicare evaluates the patient experience. And we strive to be able to improve our HCAHPS in all aspects of healthcare, and demonstrate how important that is to our employees, because that's one way the outside world knows what kind of care we provide by these scores that Medicare has, and understanding that the way we engage our patients is a reflection of how we engage our employees. It's just that simple, but as human beings, we're complicated, and making sure that everybody is on the same page there and understands what their actions represent to our patient base and ultimately to the greater world out there, is an ongoing process that, we in all hospitals pursue.
Yes. And could you share a particular moment or project during your time as CEO that you're most proud of?
So I'd have to say the decision to merge with Stony Brook is the most impactful. Of course, there were moments, other moments as well, that impacted the hospital. But the fact that our board unanimously chose Stony Brook, and Stony Brook's approach to our hospital and our mission, were that we want you to continue this important mission that you're on, to be able to meet the current and evolving healthcare needs of this population on the North Fork and Shelter Island. And Stony Brook merger ensured that we would, and we are, pursuing that mission.
And at that time, you were thinking about that early on in the 2000s, but in 2015, you merged with Stony Brook.
We made the decision to merge in 2015. It took us till 2019. The state process, it took 4 years for them to approve it, yes, which was pretty challenging. But we've been in the system now a little over 5 years.
Yes. And was there any challenges, or obviously that was just a long process, but in terms of the local community and maybe some folks having to kind of explain to them the process of that, and not that it was a consolidation of a hospital, but merging with Stony Brook, and why that was important, and that, not that you couldn't keep it as a independent.
So we were an independent hospital until we merged with Stony Brook in 2019. That we took that time. We didn't know it was going to take us 4 years. We thought it was going to be less. We thought maybe 2 years at the most. But we did take that time to engage the community about Stony Brook and all the different forums, whether it were the Chamber of Commerce or some of the civic organizations, Rotary, the Lions Club, any of those. Certainly Peconic Landing, they're big constituents of ours for healthcare. And just the greater population. One of the features of the merger is that we would be part of Stony Brook and part of their governing body. Our local board would no longer be the governing body for our hospital, and that was a very big deal. It's a local board, a representative board from all the communities that we serve on the North Fork and Shelter Island. And for the board to relinquish that control, it really demonstrated that there was a higher purpose and that something with our resource space was better achieved through Stony Brook's resource space. And that's proven true for us. So that engagement, I think, helped us. Stony Brook was well received by the North Fork and continues to be well received. And that's important because we, meaning the local leadership of the hospital, we're still out there. We're out there promoting our new physicians, our new services. We're with the same forums that we've had, and that, we don't feel that we've lost the community's engagement or the community's attention. As a matter of fact, we continue to raise money in this community as we always have. And our foundation has had 2 big years raising in excess of $5 million each year. And that's a lot for about a $63 million hospital. It's quite amazing.
Mm-hmm. And would you identify the hospital as more of a rural hospital or a small community-based hospital?
So technically it's not a rural hospital, but we have basically all the characteristics of a rural hospital. We happen to be a little too close to Peconic Bay Medical Center. If we were maybe 5 miles further, we would be a full-fledged rural hospital. And it's kind of odd to think you have a rural hospital on Long Island, but out in the East End, especially on the North Fork, you have a small population, maybe 22 or 23,000 year-round folks. You have seasonality, which absolutely impacts the hospital. We have the older population, as I've mentioned, and that we have a long history in this community. I would say we're more like a rural hospital than a small community hospital. Southampton might be kind of a small community hospital, but I consider ourselves a little more rural hospital.
Mm-hmm. And as a leader, how do you foster collaboration and innovation among your staff, especially during times of growth and change?
So employee engagement is very important for us. And so for us to make sure that we are paying the right amount of attention, we have employee surveys, and we act upon those things that our employees see as we need to improve. Almost always communication is in there, and that, as an organization that never shuts down, we're running 24/7, 365, literally for the past almost 120 years. Mm-hmm. Communication is critical for that. So we've done improved our communication, certainly with our employees, improved our engagement and recognition with our employees, and really most importantly, improved our education with employees. And that's something that was very helpful, becoming part of an academic medical center and be part of that academic mission, that learning and teaching and training. And one thing really great that came along with that is that we, in partnership with Stony Brook, in 2019 established our own psychiatric residency program, which is now fully mature. It's a 4-year program. We have 5 residents per year. And we graduated, I think, 2 classes now. And we've retained a number of psychiatrists. We have one of the only psychiatric units on the East End, of 23-bed acute psychiatric unit, and recruiting physicians, even for Stony Brook, out here is challenging. Employees are challenging, but docs are challenging too. So growing your own psychiatrists, being part of that academic mission, that teaching piece, and the employees really benefit from it because everybody gets to teach. The nursing staff gets to teach. Certainly the medical staff gets to teach. The employees get to engage with these young physicians who are training in a rural setting. Most hospitals in the United States look more like us than Stony Brook. So to have that type of experience in these small hospitals is really, really important. So I would say employee training, engagement, recognition, and becoming part of that academic mission that has really helped foster that.
Yes. And this might be more of a broader question, but with healthcare today constantly evolving, what do you think are the most critical issues facing local hospitals today, and how do you think they should be addressed?
So workforce is a big one. Having gone through COVID, hospitals took a beating, especially on the clinical side of the workforce. I'm sure you're aware there is a crisis in nursing. There's a shortage worldwide. We've had to recruit internationally as well as Stony Brook, as well as Southampton, not just for nurses, but for lab techs as well. So workforce is a big deal. Healthcare resources, being part of a large system. Stony Brook is a $3 billion system, and they are the academic medical center for Suffolk County. So being part of that and having access to that resource base is really, really important for us as well, moving into the future. And I'll say it again, communication, not only, the standard communication that you have within your organization, but the enterprise-wide communication through adapting one IT platform that allows us to communicate seamlessly and not have the problems of communicating clinical information throughout the enterprise. That's something that's really important in going forward. The use of new technology, the use of AI in healthcare is already impactful, and we predict is going to be quite significant in adopting how AI affects not only your clinical operation, but administratively how you operate as well within the enterprise. So all of this is going to be important for healthcare leaders to understand and how to adapt this particular technology, and how to be able to maintain that personal connection while doing it.
And also, you mentioned about nursing, and I was just curious, do you know why that is a challenge in terms of filling that position in the future going forward? Is it that people are just not going into that profession as much?
So I've been in this business for over 45 years, and I've seen nursing shortages. It kind of waxes and wanes, but this is different because of the pandemic. It was such a traumatizing event for the hospitals and the hospital workers, the frontline workers in particular, but not exclusively, because I can tell you that our support services, especially environmental services, having to take extraordinary precautions with this pandemic. And we were the first hospital in Suffolk County that had a COVID positive patient, if you can imagine that, all the way out here. And so, we were anticipating that we'll see this come in, the city. We see it in Westchester, maybe Nassau County. No, it showed up right on our doorstep, and it was like a gut punch to us. We organized quickly, and of course, the pandemic spread rapidly through Suffolk County and Long Island over there. And it was devastating because there was not enough information on what COVID-19 could do. We saw all these people dying. We saw frontline workers contract it and die. We saw their families get it. And it was so devastating for especially those individuals who on a daily basis had to care for these patients. The employees burned out. The profession suffered mightily, nursing and others as well, physicians, frontline doctors as well. And that we are only beginning right now to feel maybe there's a little bit of rebound. You just can't push more nurses into nursing schools because they have capacity issues. They don't have the teachers, the instructors, and that you have to gear up again to be able to even attempt to replace the nurses who were leaving. And we're so dependent upon nursing for not only frontline healthcare, but for education. We're also advanced practice nurses to work in tandem with primary care doctors because there's a shortage of primary care doctors. We're counting on advanced practice nurses to help us with the shortage of primary care. So the nursing component of hospitals, while always critically important, now becomes the important thing, recruiting and retaining the staff, educating the staff, recognizing the staff. This all becomes a crucial part of operating your hospital and health system. Healthcare's focus on nursing training, recruitment, and retention is quite significant. But I would be negligent if I didn't include the other hospital employees, the other licensed and non-licensed employees who are critical to our everyday operation. Certainly, you can't have a conversation without talking about the whole team, not just nursing, even though we know the importance of retaining a good, high-quality nursing staff. The same goes with all the other employees in the hospital.
And healthcare is a deeply personal industry with many emotional highs and lows. Can you share a time when you faced a particular difficult decision as a CEO and how you navigated that?
So there are two times. One is Superstorm Sandy, where we had to evacuate the hospital. I never want to evacuate a hospital again. We did it. And we had help from, and this is in 2012, October 29th, I'll never forget it. And we had help from, at that time, Northwell. We had help from Stony Brook to be able to move our patients, into other hospitals and away from the hurricane. We actually had help from Peconic Landing, where we took our rehab patients, which is basically a subacute. It's not an acute unit. But, we try to discharge as many patients as you can because it lightens the load for the patients who can't be discharged to be transferred to other facilities. And we actually got the use of Brecknock Hall overnight for that particular group. And I remember Peconic Landing making sure that the place had, because they use it for social events, but there was no liquor in there. We had to make sure that the place was cleaned out, and we fed them pizza and soda, and it was like a little camping trip overnight for them. And we brought them back the next morning. The hospital never lost power. We were running emergency generators only because we know that Greenport needed us to do that as well, and that our employees actually went with the patients and stayed with those patients until they came back to the hospital, which is extraordinary because those employees have their own families at home. And it just shows you the culture of caring, that stands out big time in my mind. But the decision to evacuate was momentous. The other decision, of course, was the development of our COVID unit. And we're very proud of the role our hospital played in inoculating almost 16,000 people, with the vaccine. That was quite extraordinary, not just at the hospital, but at Peconic Landing, and working in concert with the town of Southold on Peconic Lane, and other places in the firehouse on Shelter Island. Our pod team was terrific, and they went all over the place, and they did a great job. That was, I was very proud of our hospital, our employees there during that time. And of course, the momentous decision to join Stony Brook that our board unanimously made was like the third, but the hurricane, that was a big one. That was, that was a tough one.
And do you see that moving forward? I mean, just in terms of the location and climate change and like an emergency plan, is that talked about? As well as also, you mentioned COVID in terms of any other health emergencies that might come up in the future, that having to plan for something like that comes out of the blue.
So every year we do a hazardous evaluation. It's called HVA. Every year we do it. And what has come out on top almost every year was a storm,
Mm-hmm.
in particular a hurricane. Although we've been hit hard with snowstorms over the years, it's been the hurricanes that, we had the back-to-back with Irene in 2011 and then Sandy in 2012. And that was a significant lesson for us. So these HVAs are important to determine if there's anything else on the horizon. And there is something else on the horizon called the pandemic, which turned everything on its ear. So I worry about West Nile virus. I worry about bird flu. I worry about any of these things that I typically wouldn't have worried about had we not had the pandemic and COVID-19. So now we have another threat. That's the threat of having another pandemic. And while we have experience and understand what we have to do to be able to address that, it's not easy to reconfigure an organization as we had to. We had to shut services down. We had no addiction. We had no detox or rehab. We did have psychiatry. And we had very little medical surgical. We couldn't do elective surgery during COVID. All of this also has a financial price that hospitals took a big hit. And Stony Brook, because of their unique stature, they had 500 COVID patients in the hospital at one time. And that's just astounding. We had 18, but of course we only have 70 beds. And then we had really 40 beds operating. Mm-hmm. So that's almost half of our patients, but 500 out of it, there are 600 and I think 20 or 30 beds. That's a big number. Mm-hmm. And a lot of the hospitals, including Stony Brook, have never received the money that we are supposed to get from FEMA. Mm-hmm. FEMA owes a lot of hospitals a lot of money, in particular Stony Brook Health System a lot. So we all wait for that to be reimbursed many years later beyond the pandemic. But these are the things I do worry about.
Mm-hmm. And also, I don't know if you'd say healthcare has shifted to a more patient-centered model, but how do you work to create an environment where patients feel truly cared for on a personal level? And is that a challenge in terms of, like you said, with staffing and making sure patients can get the care they need?
So for us, we had this unique culture, this culture of caring, this high touch, that by definition is patient-centered. To be able to teach to that, which is what we do, only helps us foster that culture that we have. And being a smaller hospital, I think, to be able to focus on that is a bit easier than if you're a larger facility where people, come from all over the place. And look at healthcare, especially frontline workers. It's not just a career. In many cases, it is a calling. And I do believe nursing is a calling. To be a good, responsive nurse, you have to really care about people. And, that's what we see in our nursing staff. So organizing around that culture for a more patient-centered focus for us has not been a huge challenge. To maintain it and to ensure that it is equally there in all aspects of our care, that's always the challenge. But making sure that culture is understood by new employees. I always say we have this culture of caring, and that when you see it, you know what I'm talking about. And then when you actually are part of it, you'll feel it. You'll actually feel it. In a small hospital, you can feel things more within the community than if you were a larger hospital.
Mm-hmm. And also, I had another question. You mentioned you've added, was it a psychiatric
residency program?
Yes. Program, but in terms of the community in Greenport on the North Fork, have you seen that as a real important issue in terms of even mental health or even a rise in people that need help within that area?
So here's the difference. When you have a hospital that is providing inpatient care, inpatient acute psychiatric care, or for individuals with substance use disorder, these individuals are treated in a hospital. When they get discharged, that's where the problem is. We don't have sufficient community-based mental health services on Long Island, in New York, probably in the country. And that the development of those local resources for behavioral health and mental health is really, really important and challenging, because the economic aspects of developing a community-based mental health program are very challenging to make it work, to be able to make it survivable. The reimbursement for these programs is not significant. And so oftentimes these programs have to be subsidized. Certainly, when you have a large academic medical center with resources, you have much greater potential to provide these level of services than you were a small hospital. Right now, Stony Brook is focusing on deploying medical subspecialty and additional primary care out here, because that's really what we need. We need neurology, we need more urology, oncology. That would be the medical subspecialty. We need more primary care as well. But the development of service lines for our hospital through Stony Brook will be the immediate future for the North Fork. Development of mental health outpatient services. I think we do have a large program in Riverhead. It's right now focused on treating people with substance use disorder. They can have a secondary psychiatric diagnosis or another medical diagnosis, but it has to be primary for substance use disorder. We are in the process of developing what they call an integrated license. That means we will get an OMH, Office of Mental Health license. So we'll be able to treat individuals with primary mental health diagnosis, not just secondary with, or co-occurring with substance use disorder. That will be very important for us and help us be able to do a better job in treating individuals who have that primary diagnosis.
But have you seen a rise even with substance abuse or fentanyl use out here in the last, say, 5 years?
So while statistics now appear to be slightly declining in terms of deaths from overdose in Suffolk County and New York State and nationally, which is great news, fentanyl is out here. And, we did have that tragedy a couple of years ago where I think there's 6 local individuals all overdosed and tragically died. And it showed you that, out here on the North Fork, we are not immune from this. And even though people read in the newspapers this happens, when you see it in the community and you see the level of tragedy and how it strikes the community, it is completely something different. We responded to this with the business community to develop Narcan stations. Like the library has an AED. Well, we think we should have a Narcan station. So we worked with Rich Vandenberg, who is the Peconic Brewery, Greenport Brewery, and other business leaders, as well as a local not-for-profit called CASJ. Don't ask me the acronym, but they were very instrumental in helping us train folks on how to administer Narcan. I got trained. It's very simple to do. And we've had some success on the North Fork in deploying these Narcan stations. So I was speaking about some of the physicians who are new to our community. I talked about Dr. Luke Swezak, who is a general surgeon, board-certified, minimally invasive surgeon, who just joined us. We're very fortunate to have Luke. I mentioned John Rowe, who's also a board-certified, fellowship-trained orthopedic surgeon. We also have Ashton Stanton, who is board-certified in spine and minimally invasive pain management. Well, and Dr. Kimberly Hsu, who is a family practitioner of primary care, who has been in practice in Mattituck for about a year.
Now, there was also you've been adding other new things to the hospital, and one of them was the stroke center is one of the new services you offer. Could you talk about it and how it came to fruition?
So this is important because we do have that older population that I referred to before, the oldest population per capita in the state. And we know that strokes, 2/3 of strokes happen in people over 65. So having Stony Brook Eastern Long Island Hospital as a primary stroke center just makes so much sense for our community. And our community is embracing this. We've already raised probably $250,000 towards the development of a stroke center. It's going to cost probably about $1.5 million, $1.6 million totally. And some of that is capital equipment. We have to get an additional CAT scanner. And then, of course, there's additional staffing that we need to go through. Right now, we are in the development phase of the primary stroke center. We anticipate we'll be ready to submit our application by the end of this year. And then hopefully in the first quarter, maybe not too much longer, we'll go through a survey to ensure that we are ready to become a primary stroke center and receive certification maybe by mid-year of 2025. That's the goal. But deploying this for our population, for a group like Peconic Landing, which is about 430 average 82-year-olds, it's quite significant. And rather than having to take the individual 20 or 30 miles down the road, you just go 1.5 miles. And that's really important because there's a thing called the golden hour. When the EMTs identify somebody who has neurologic symptoms, they have a whole algorithm to follow. And that the most important thing is to get that individual to a place where they can diagnose and begin treatment. And that's what our primary stroke center will do, rather than driving 25 or 30 miles down the road and using half of that golden hour. Let's use 15 minutes of the golden hour, and then we'll be able to get the person in the CT, get the labs drawn, and initiate treatment if it's required. We also have a telestroke feature with Stony Brook. So we can turn on the telestroke machine and we have a board certified stroke neurologist right there at that time in your ER, which is another really important feature. And certainly that's another real benefit of being part of the Stony Brook system.
And I had 2 other questions, but I had one question before that. Just, do you have any other future projects or ideas you want to accomplish in the future, or whether it's expansions or renovations on that site or other centers?
So we have a number of them, but I'm going to go back to the hazard vulnerability analysis, the HVA. So since Sandy, we have raised money to build a seawall around the hospital. We have a new weatherproof, I'm going to call it weatherproof, emergency generator. And then the major project is to take our electrical distribution system, which is where all the power comes in and is distributed throughout the hospital, out of the utility room and put it up high on concrete dunnage, higher than the surge plane, which is right next to our generator. Because while we were experiencing the greatest surge of Sandy, this electrical distribution system basically has a pit under it that's 12 feet long, 3 feet wide, 3 feet deep. Never had we seen any water in that at all. And hydrostatic pressure apparently caused water to come in and come up to close to hitting live electricity, which would have just blown the whole system up. So we saw that as a significant vulnerability. So now we are taking action to take that whole electrical distribution system out of harm's way and move it away. That further, the storm hardening is really important. We also have, we'd like to expand our emergency room. That's probably a 2026, 2020, maybe the end of 25, 2026 project. And we'd like to be able to update and modernize our OR space. And while we have current and up-to-date equipment in that OR, the space needs to be more contemporary. And we've actually already raised money for that, but we need to get this electrical distribution system done first, and then those other projects will follow.
Wonderful. And so in terms of you coming out here and working out here, what do you enjoy most about living and working on the North Fork?
So what is unique about that is that living and working in the same community, I had not experienced that as a hospital administrator in my previous employments, and that it is a whole different situation. that rather than commuting to your hospital and to that community, you are now part of that community. And that hospital now becomes more meaningful to you because that really is your hospital, not some place you just work. And I think anyone who has experienced that understands what I'm saying. I see individuals, when I'm out at the grocery store or or picking up dry cleaning or any place that I may go. And those individuals can have something to say about the hospital emergency room, their experience. And for the most part, this has been an excellent experience for me. The hospital is well regarded by the community. And yes, there are things we can improve. And yes, there are problems that we have like every other hospital. But we seem to do really well with this. The thing about the hospital, the obvious thing about the hospital is that we've been here 24/7, 365, times that almost 120 years. That's extraordinary. That's remarkable. And that people count on that, especially the emergency room, to be available for them. The other side of this is not so well known. Being the largest employer on the North Fork and buying goods and services in and around that, we have an impact of about $20 million on the economy. And that together with the availability of the medical care, I call sort of the well-being factor, and that it's good to have a hospital in your community, not just for the obvious reasons, but maybe for those other reasons that maybe you don't think about as much, that creates this well-being factor.
And lastly, what do you hope for the future of the North Fork and its community as a whole down the line?
Well, like everybody, you want to preserve the character of this, and you want to be able to manage growth the best you possibly can. In the 25 years that I've been out here, a lot has changed in the North Fork, and that we talked a little bit about that. And not all, people don't always see change as positive. I think change is unavoidable, and it's how we participate in that change and how, if we can be so bold to help manage that change. I think the environment in particular with climate change is a big concern, certainly for me and the individuals I talk to out here. You already see sea level rise, and we're fortunate to have our seawall in the hospital, and we're going to take other precautionary steps to make sure that the hospital is protected, because we're not going anywhere. We're staying where we're staying on these 6 acres in the middle of Sterling Harbor. We're staying on there, and we are adapting to that to make sure that the climate change will not have any type of material effect on how we deliver healthcare.
And then just lastly, I'd just like to ask at the end if there was anything else you wanted to say or discuss that we hadn't talked about.
I think you covered it.
Okay.
If I think about it, I'll call you. But
Okay.
I think this was very comprehensive. Thank you.
Thank you very much. And I want to thank you for taking the time to come on the podcast today and share your story and career out here and keeping our hospital going and moving forward in the future. So thank you so much.
It's been my pleasure. Thank you for asking me.
Well, I hope you enjoyed episode 99 with Paul Connor. I want to thank you for listening to the Floyd Memorial Library podcast, and we'll see you next time.